to draw blood. There are many reasons of why you would get your blood work done, and most people do it routinely, and this could get your complete blood count, your kidney liver functions, and your blood sugar levels. And then it's common for them to do it before an operation, so just to make sure there's nothing abnormal before a major surgery. And toxicology is basically just drug screening and checks medication levels. And then patients that are acutely unwell, they will do blood work just to see what's abnormal and what's making them sick. So as a nurse, the first area that they would do blood work would be the antecubital fossa in the front of the elbow. And there's 3 major veins there that they look at. The first one being the medial vein, which is in the middle of the elbow, and then the cephalic vein and the basilic vein. So when you are giving or taking blood, the first thing you do is greet the patient and just make sure they're comfortable and warn them that it could be a little bit painful. They might feel a prick. And then just ask them if they've had blood work done before and where they've been successful with it. So it'll just save you some time looking around at their veins. So then once you find a good area, you just apply the tourniquet. And here's some different methods of how to tie it. And the best way would probably be to be able to undo it with one hand. So once you apply the tourniquet, you will palpate for the vein, and the vein, so that if it's hard to tell which one is the vein, you can just feel for the spongy texture and the bounciness of the vein. So once you feel for a good vein, then you will clean it with alcohol and get your needle ready. So the needles have a bevel right here. So the bevel side needs to go point up into the vein, and when you insert the needle, it needs to be about 20 degrees. So right here, it shows it going in straight instead of directly down, so it doesn't puncture through the vein. And then once you insert the needle, you'll feel the give of the vein, and that'll help you know that it's time to get the bottles ready for the blood. And so once you fill the bottles up, you take the tourniquet off, and then you can take the needle out. Just make sure you don't take the needle out before the tourniquet comes off. And then once the needle's off, just have the patient apply pressure for a little bit to make sure that the site is secure. And then just wrap it or put a Band-Aid on